you're going to get different knowledge and skills to help you go ahead and pick a pathway. And we will be coming into your class to talk to you a lot more about pathways, so don't stress about having to pick one right now. We're just giving you information right now to kind of help you narrow down your choices. In your English class, you'll be doing assignments and different little surveys that'll help you narrow that. And then in a month or so, I'm also going to be coming into your classrooms to talk to you about Naudiyant, which is going to be a tool that you're going to use to compile all this information in to also help you narrow down your pathway. Because ultimately in December, I will come back into your English classrooms and we will choose our pathways, and then we will start building our schedule for the next 3 years. Okay? So we're gonna go ahead and let our panel introduce themselves in just a minute. Each one of them will introduce themselves, and then I have some questions that I will ask them, but feel free if you have additional questions or if you need to clarify something with them to raise your hand so you can also ask them those questions. All right, are we ready to get started? Any questions so far? All right, so panel, if you would please introduce yourself.
Okay,
We'll start with you.
Good morning, everybody. My name is Tanya Sutton. I work at the Fremont County Department of Human Services, and I am a child welfare supervisor.
Good morning.
Good morning, I'm Tanya Marushak. I am a realtor in Canyon City, so I'm representing the business side of things today.
Good morning, my name is Ethan Friedman. I am a physical therapist at the St. Thomas More Hospital outpatient rehab. So I'll be talking more about healthcare and those options.
Good morning, I'm Michael Rourke. I'm the Chief Probation Officer for the 11th Judicial District, and I'll represent the behavioral health side of things.
All right, panel, can you please answer the first question? Why did you choose your job? We'll start with you. We'll start with you this time, and then we'll go the other way next time.
All right. So I actually, I don't think that I really chose my job, to be honest with you. Growing up, I wanted to be an attorney, but then I figured out like how much time that takes in school, so I changed my mind. And then I really wasn't sure what I wanted to do. So when I started college, I just happened to enroll in an intro to social work class, and it really, really grabbed my attention. At that time, I was actually working for a child care center doing daycare and those sorts of things, so I thought I would work in early childhood. But then an opportunity came to me, actually, to work at the department, and it was doing a lot of the same things I was doing in early childhood, so I thought it might be a good fit. And 12 and a half years later, I'm still there, and I've changed a lot of different roles within the department. So it actually happened just because I let those doors kind of open for me.
For me, my path was a little bit different. I started real estate 4 years ago, so I actually changed my path. But real estate was always something that I wanted to do, and the neat thing about that is you're your own boss. You are a sole proprietor, which means that you are your own boss and you get to do things. It's something that I've always wanted to do. Even back when I was in high school, I loved looking at houses and doing that. So just in between a gap where I was at home with our children, and then finding different things to make me happy, I finally decided that this was what I wanted to do my whole life. And at age 42, I went back to school to get my real estate license and have been doing it ever since, and I've never been happier.
In high school, I guess, and earlier growing up, wanted to follow my dad's footsteps. He was an engineer, so that was kind of where I started on, I guess, more health, science-based stuff. And I wanted to be more medical-based, so I was looking into biomedical engineering, which would be like designing pacemakers or medical devices of some sort. And the more I read into it, the more I kind of realized that I wasn't going to be working with patients. I was going to be kind of behind the scenes. And I wanted to be more on the front line, so to speak. So I shadowed a physical therapist in high school, and I loved it. Kind of fell in love with the profession and what you can do, and so I just followed that pathway. college for all the years for it, and I've only been working for coming up on 4 years, 3.5 years, and pretty much just kind of fell into it because it was a combination of everything that I enjoyed. I like the math and science aspect of it, but most of all, it was helping people and working directly with those people to make a better change in them, and that was really powerful. So that's pretty much why I picked it.
So I went to college in Pueblo at CSUP, and I started out as an engineering degree, and I realized about midway through that really I didn't care for math, and I didn't want to make a career out of math, and so I had to make an abrupt halt. And what I did like at the time was working with my sociology classes and working with people. So I realized at that point, I want to work with people. I wasn't quite sure what I wanted to do. So I was a sociology major with a social work minor. And so when I graduated college, I went to work for a sheriff's department in Grand Junction. I came back and worked at the prison for a little bit. I worked as a child protection worker at DHS, where Tanya works. And there were aspects of all those jobs that I liked, and so I kind of mashed those things together. What it really looked like was kind of a probation officer. And so I applied 22 years ago, and I became a probation officer and then a probation supervisor, and now I'm the chief of a district. And it's different. I'll probably talk to you guys throughout answering those questions from the perspective of a probation officer, because that's the biggest group of people that we have working in our field. So I'll put it to you that back in the day when I was a probation officer, but that's kind of how I fell into it.
Okay, do we have any clarifying questions that we need to ask at this time? All right, panel. Tanya, can you describe one of your typical work days for us?
There is not a typical work day in this business. You have to be ready to do anything at a moment's notice, whether it be showing houses, doing an inspection with an inspector. So I think that's one of the things I enjoy about this job, is that it's a blessing and a curse, actually. You don't know what your day is going to look like. It could change at a moment's notice. So I don't have typical days. I don't have a set schedule. I don't have any type of routine. So that is one thing that, like I said, it's a blessing and a curse. It keeps you on your toes. It keeps you have to be able to multitask and handle different types of people at any given day. I could be dealing with 10 different people on 5 different houses, and it's all different. So I think the biggest thing is just, being able to multitask, but there is no typical day in my job.
And my day is pretty much the opposite. My day is very structured and regimented, and that's where I strive. So that's perfect for me. I'll back up a little bit. So the outpatient department where I work, we have 8 physical therapists, and we have 4 physical therapy assistants. And then in the inpatient department, so working directly in the hospital, we have 1 physical therapist, 1 physical therapy assistant, and then we also have an occupational therapist and an occupational therapist assistant, as well as 2 occupational therapists in our outpatient department. So we have a lot of people working in this small space, so it all has to work kind of perfectly. And I don't really have numbers off the top of my head, but we're seeing roughly 150 to 200 people per day in the outpatient department. That's not including the hospital, people admitted, people just coming out of surgery. So there's a lot of cogs working in different departments, and it all has to kind of flush together. So I've chosen to work 4 10-hour days, and I'm really lucky to have that flexibility to choose when I want to work. So I have every Friday off, which is awesome for me, especially because I like to do stuff on my weekends. So I start at 7 o'clock, that's my first patient. So I'm usually at work at 6:45, doing a little chart review, looking at the patient schedule, seeing if there's new people that I need to read up on. If they're recurring patients, meaning that I've already treated them once, then it's just a daily treatment session, so it's a little bit different. I already know about them. And so I'm usually seeing roughly 13 patients a day if I have a full day, every 45 minutes. And so every 45 minutes is including an evaluation for a brand new patient as well as a treatment. So it's the same time. And if it's an evaluation, new patient, They fill out all their paperwork when they come in, like you normally go to a doctor. And my job is to diagnose them. If there's something that I can treat them immediately, I will do that. And then I create a treatment plan for them. And we talk about exercises, we talk about changes to their daily activities, their living environment, things like that that will help them. And these new patients could be coming after a surgery, they could be just dealing with a chronic low back pain. We see a lot of varying ages, younger than yourselves, and then we see people up into their 90s. So it's kind of a wide variety there and different diagnoses, which is the one thing that keeps it fresh, keeps it new, and you always get new diagnoses, which is always fun to do some research and get something new. If they're recurring patients, then I've already done an initial evaluation, and so I'm just doing them a daily treatment, which can include exercises, it can include manual therapy, so hands-on work, could be including more of like a neurological re-education, could include gait training if they're new out of a total knee replacement or a total hip, or like a leg fracture or something and they're learning to walk again, or an ankle fracture or an ankle surgery of whatever kind. So there's a lot of different varying things that we need to, could be working on a daily basis. I also have to work closely with our associates, our coworkers, our physical therapy assistants, who sometimes I share a patient with for various reasons, whether my schedule is full or I think they would be better working with, a different practitioner and kind of alternating. Other things that we deal with are working with the pool. We do have an aquatic therapy center in our outpatient rehab, and that is all taught by our physical therapy assistant. So sometimes I have to work closely with them to talk about how they are progressing, he or she is progressing, if it's appropriate to continue in the pool, or if it's more appropriate to return to what we call land therapy, which is normal therapy with me. So a lot of things go on there. On the other side of that, we also have to do paperwork, lots of paperwork. We have to document every single thing that happens every single day that the patient comes in. And that can get pretty tedious, especially with an initial evaluation, because there's a lot of documentation we have to do. And we try to do this actively, meaning that as the patient is there, we are working on actively documenting so that we're not stuck at the end of the day with 13 notes to do and trying to remember what you did at 7 o'clock in the morning at 5 p.m. That's not a good way to go, and you'll be there forever. So a little bit of time management, multitasking for sure is crucial. Always critical thinking whenever I'm working a new evaluation or just daily treatment. If something else pops up, like if someone starts having something that's kind of gross for this morning, sorry, but like if something's like draining out of a knee wound, I need to like critically think, is this something that requires a doctor consult? Do I need to send them to the emergency department immediately, or is this perfectly fine? So like stuff like that I need to always be aware of. Let's see, what else happens in my day? That's pretty much it. But it's a long day. So like I said, I work 10-hour days. And sometimes I get behind, and I think everyone will say the same thing. Sometimes it just piles up on you. You get a couple tough evaluations, tough patients, manually focused patients that you have to be hands-on. You can't really document at the same time. And then at the end of the day, you're stuck doing a bunch of notes, and that can be exhausting. And then repeat the same thing the next day. And there's, on the way other side of that, there's also communication with insurance companies. We have to make sure that every patient has an authorized number of visits. So if that is coming close to the end, we need to request more visits if it's necessary and indicated. And there's certain criteria that go into determining if that is necessary or not. And there's more forms that we have to fill out to request more, dependent on the insurance carrier that they are provided by. So, and then of course talking with doctors, talking with physicians, referring providers, physician's assistants, nurse practitioners, everybody is all in the loop working towards giving the patient the best care possible.
So most of the probation officers, similar to Ethan, work 4 10-hour days. It tends to work for them. We have a couple that work 5 8-hour days. It's semi-structured, so I think it's kind of a blend of those, their two work environments. Some things as a probation officer are very set. If you have court at 9, you got to be there at 9 o'clock. And if you have court at 2 o'clock, then you've got to be there at 2 o'clock. What happens in between are the things that can change and be very dynamic. So typically POs in between, like say court or meetings, they'll have scheduled appointments. So, if you're sentenced to probation, you come in and we do assessments. We start with how frequently you're going to come see your probation officer, and that could be, generally speaking, it's once a month. There are some that have to see their probation officer more, and there's some that have to see their probation officer less. So based on that assessment information, you'll see clients, typically anywhere from 5 to 10 clients per day. And when you see a client, you're talking about, are they meeting kind of the court orders and then just working on other general case planning. So to hear Ethan talk about their case plan, we case plan for our people. So if they have behaviors like, substance abuse, domestic violence, drug addiction, we're working with, shops out in the community, so treatment providers. So we're referring them to treatment providers. They're going there for help. We're trying to get them healthier. So Ethan works with, deficiencies in the body to build them back up. We work with people's deficiencies behaviorally and try to get them back to what we would consider kind of a normal state. And that's the same type of an assessment process. So we assess what needs to change, and then we work on therapy, not so much physical therapy, but emotional and behavioral therapy to try to get them back in the community, back where they can be safe and not continue to have the types of crime that they came to us for. So, in between though, we might have situations where we get a call, maybe a high-risk domestic violence case is having some issues. The probation officers then might team up, and we always go in prayers for safety. They might go out to their home and pay a visit, make sure if they've allowed the victim to be back with the client, then we want to go make sure that they're safe and that there's not any issues. So we do home visits, we do employment checks. Basically what we call those things is just off-site checks, and so they do a lot of off-site work. Not so much during COVID, of course, but so we're kind of based more just in the courthouse. And so, again, any given day you have those things that you have to go to, and then you have things that just come up and you have to kind of drop and be pretty versatile in managing your day and your time.
So I would say DHS is a lot like probation in that our schedule is pretty similar probably. Obviously we also have court that we have to attend, and so court meetings, those sorts of things are very structured, but in between there's always crises that we're trying to mitigate. So child welfare workers are often in the community, we're in people's homes, we're doing home checks, doing home visits, providing transportation. Our schedules didn't change during COVID. The only thing that really changed was not everybody could be in the office. So we were really part of that frontline staff being out in the community still, going in people's homes, just to ensure safety of children and families. So we, a lot like probation also, help people to find services that are court ordered on their treatment plans, and also on a voluntary basis. Not all families we work with are court ordered to do so. We provide services such as parenting classes and co-parenting classes and life skills services. So we're really trying to help build up an entire family instead of just the individual. We also offer parenting time. Sometimes we have to supervise parents with their children to ensure safety. So we're doing that either in a home, in the community, at our visitation center. As a supervisor, I would say my day is much more structured. I have a lot of meetings, but the workers, they're jumping from meeting to documentation to court, and they really have to be able to multitask, think on the fly, be ready to just kind of leave at the drop of a hat. So some days can be pretty chaotic. Other days, the days we really like, are a little bit more low-key. There's always documentation when you're working with the government, so we have lots of documentation, lots of paperwork we have to do, and sometimes we don't get that done during the day. Sometimes that's something you have to take home and do, at night after the kids are in bed, and sometimes you're working over the weekend. We also have on-call caseworkers, because we have to be ready in times of crisis if law enforcement calls or if a family needs assistance. So somebody's always on call 24 hours a day, including a supervisor for kind of that backup piece. So not really a typical day in child welfare, but it's always pretty exciting.
Okay, thank you, panel. So do we have any other questions that we would like to ask the panel about their typical day? All right, so Ethan, you have the next question to start with. Can you please tell us what is the most challenging part of your day?
Sure. So, challenging. I think the easiest thing to say is like documentation, just like it's a lot to do. Sometimes it gets behind, but I think the truly most challenging thing is working with patients who are not getting better and trying to weed through why that is. Is it something that's functionally limiting them? Is it, like, for example, if we're talking about a knee that's not getting better, not getting more range of motion, not getting stronger, is it one because that there's scar tissue underneath the knee that's stopping that patient from increasing that range of motion? Is it their pain? They just can't tolerate the pain of bending that knee any further, and that's limiting them. Or is it more of a mental, psychological issue where they are afraid, they're not confident with bearing weight on that left leg anymore, or whatever the issue is. So there's a lot of like working through with not only the patient, but their caregiver, if it's necessary, their family members, and trying to find the best route to get them better and trying to get to the source of what the issue is. That could be very challenging, especially with patients that are generally older, potentially with dementia or other mental psychological disorders. That could be very challenging to work with. We do see a lot of people from StarPoint, and they already have mental, physical disabilities, mental impairments that make it very difficult to communicate, for physical management of their positioning, all that kind of stuff. So there's a lot of challenging patients in that regard, but it makes it so much more rewarding when you break through, you find that source of the problem, and you do see improvement, or you get them back to walking functionally. They're back with their family members and they can shower on their own. Some like little milestone that they weren't able to do before can be extremely rewarding to see them able to do it themselves. And that can happen with every joint. So like shoulder, if someone can wash their hair again, right? Something like that you wouldn't really think about having an issue with, but until you have an injury and can't do it, it can be really challenging. So I think that's the give and take. Those are the challenging patients, but it's also the most rewarding when you kind of break through and you can get an improvement.
So I think similarly, we, probation officers have difficult clients. And so if you can kind of imagine what a difficult client looks like, they're just resistant to change. And so, we're working with them, treatment providers are working with them. Again, probably addiction is one of the easier examples to give you. Anytime you become addicted to something, whether it's, chocolate or iced tea or, coffee, whatever those things are, it's never easy to give those things up. So when you're talking about issues of substance abuse, alcoholism, those are things that people have learned. They've learned how to cope their lives with that stuff, and that makes them feel normal when they're using drugs and alcohol. So we're tasked with the idea that we're going to, within a period of a year, sometimes 2 years, try to get these people healthy and, again, abstaining from drugs or alcohol and kind of being on a pathway that is healthy for them. And so a lot of people that come into our shop don't recognize that they have a problem, 2, don't want to change, and they've been ordered to do so by a judge. So that's our challenge, is how do we do that? And so luckily, probation officers are well trained in ways to get them to examine their behaviors, and the treatment providers do a great job of, again, trying to give them the tools that they need to be clean and be productive. And a lot of times it might be as simple as us asking them to be clean for a week to start. So you just do baby steps and try to build on that. And then they're getting the treatment, along the way. We also have a lot of technology that we can use to meet those challenges. So we have ankle monitors that detect alcohol use. Most of our clients have to do urine testing, which again is just peeing in a cup, and then we send it off to a lab, and then that's how we monitor their substance use, because we're not with them 24 hours a day. And that's the other big challenge is how do we get these people to change when we can't monitor their every minute of the day? And so those are some of the challenges that probation officers face, but they are given a lot of good tools to work with. Eventually what it comes down to is there's a cycle of change, and if you can just get little breakthroughs here and there and get them to examine and maybe look at their life from a different lens, and that lens might be like, what would it look like if you didn't, use drugs and you had a job and, you got your kids back or you got, other things like that. That's ultimately what we use, and eventually those thoughts like kick in, and then that's the reward for my staff, I think, is when we see those people that maybe were highly addicted or, whatever, and then they make some breakthroughs, and then they're clean for, a month, and then they're clean for a year, and then they'll come back sometimes and say, I've been clean for 10 years, thank you for helping me during those tough times. So that's kind of the challenges and the reward. So it might be for somebody in this room.
So I would say the challenges truly are the paperwork and the documentation. Most of the people that work at the department were helpers kind of by nature. And so we realize that we're gonna have, kind of like what Mike was talking about, those days where it's just really frustrating because people don't change, they don't do what they're court ordered to do or what you ask them to do, or what they truly know is right. But we wanna kind of fix that, right? And so we'll come back to try to fix it all day long, but then having to document the fixes is really, really frustrating. Most of us would rather be working with the clients one-on-one, working with those individuals and working with the families, and documentation just takes time away from that. So everything we do, we have to document. There's always paperwork that goes along with it, and it's oftentimes super challenging because that's not our favorite part. I would say the other frustration or challenge is lack of resources. Being in a small community is tough. I grew up in Canyon, so obviously realize, that we don't have a lot of the things that metro areas have, but it really came to light when I started working in the field, and hear from Denver County and Boulder County and Douglas County, all these great resources they have, and we just don't have that for our families, and that's super frustrating. So it's important, I think, to just know that there's gonna be those frustrations and those things you can't change about your job regardless, but if you're willing to put in the work, hopefully you can get some better outcomes.
I think the most challenging part of my job is dealing with different people's personalities. It is, and it's the schedule, and it's multitasking and making sure that you're not getting burnt out. There's days, like Ethan says, he works 10-hour days. There's days where I start at 7 a.m. and I don't finish until 9 p.m. Because of other people's schedules, and so you have to be willing to do those things sometimes, but then also finding that balance of having your family time and making those things a priority and what's important as well. So for me, it's balancing different personalities. Some people can be super demanding. This is my lifeline, basically, when it comes to my job, texting, phone calls, email. I'm constantly on this, and so this is another challenge as well. You want to put it down and walk away from it, but then also you have to be ready to, if something happens, an emergency or water breaks at a house that you have listed, you have to be willing and ready to go at any time. So balancing all the different personalities and all of the different components that go into it is that is my biggest frustration with this position.
Yeah, I'd just like to add one more thing. I think that there's like a underlying theme with everybody here, and I'm not sure if I articulate it really well, but just trying to get across and how you get those breakthroughs, at least for me, and I think maybe others will relate, is just making sure that the patient, client, whoever you're working with, that they know that you're working for them, you're on their side, and that's always a big thing to get across, and for them to understand it. That'll really help, at least for us, and I'm sure for every other field as well. So that's kind of understated. It's hard to do. You can't just like snap your fingers and say, hey, I'm working with you. You should, help me out now. It doesn't work that easily. But yeah, that's another challenge to make that point known.
All right, thank you. So we talked a lot about training. So Mike, can you please expand on the training and talk about what kind of training, education technical knowledge, experience that you need to get into your job field?
Sure. So when you're hired on as a new probation officer, you actually go to a probation academy. And so it sounds more glamorous than it really is. It's not like the police academy where you go learn takedowns and shooting and all that kind of stuff. But what you do is you get the basic framework to be a probation officer. So they'll train you on how to do a level of supervision assessment, how to case plan, how to utilize motivational interviewing. So that's a biggie when Ethan mentions like what we're trying to do in any of our fields. One of the biggest things that we'll all tell you over and over again is communication. And so whether you're a probation officer or a physical therapist, whatever that looks like, you have got to be able to communicate effectively with your peers and your clients and everybody that you work with in the workforce. So, just keep that in mind. And so when they go to a week-long training, those are the types of things that they're gonna really train them on, is effective communication skills with clients, how to come alongside of them and motivate them, because within the last 10 years, that's been a change in probation and law enforcement in general, as we're not as much adversarial as we used to be. We used to just kind of challenge them like, you've got to go to these classes, or you can't be hot, for math, you can't be hot for whatever. And we didn't see as much change happening. So when we made the change to like, how do we get them more motivated and how do we incentivize like changing their behavior, that was when we started to see more change. So we started doing things like, hey, if you're clean for a week, we'll pay for your UAs and you won't have to pay for them. You'd be surprised at what that does. And it goes back to, I think all of us as human beings, when we were young, if we're educated and motivated to do things, we would do it more. Sometimes if we were just smacked on the hand, we might still continue that behavior. So, and there is a physical training to being a probation officer too. Once you go through the academy, they teach you some other basic skills, and one of those is like a physical fitness course where we learn, takedowns and those kinds of things. But we're not encouraged to really use those unless we are in a situation where we had to defend ourselves. So, the good news is probation is it's safer than law enforcement in general right now, because we work a little differently than the frontline law enforcement. And so by virtue of us being in teams, usually when we go out in the field, we don't see as many assaults, and we have security at the courthouse, so we don't, knock on wood, we've been lucky that we haven't had any staff assaults in our offices. We've certainly had clients that escalate, but again, we're taught de-escalation skills. So usually that's really one of the effective trainings that our staff learns, is when somebody's, totally upset at the world and the courts and everybody else and their attorney didn't do a good job and they're in there, complaining to you, how do you get them to focus and bring them back down to a level where they'll listen? And so, it starts with those general skills. And again, there's 40 hours of training for a PO every year. So there's always lots of training offered, and a lot of times they come to us with those skills already. That's what we look for when we're hiring. So I think that's what's great about like a high school pathway system and internships. You guys can come out of high school with a lot of those skills that maybe, I wouldn't have had when I was in high school, outside of things that I took on, maybe, outside of just general coursework. So it's a great opportunity.
So to be a caseworker, you have to have a minimum of a bachelor's degree in a human service field. And then much like probation, we also have an academy. We don't learn any takedowns, unfortunately. That sounds super fun. For us, it's truly learning, kind of like Mike talked about previously, that cycle of change and family dynamics and those sorts of things. We have to have a legal prep training because everybody is in court at some point. Sometimes testifying. And then we also have 40 hours of ongoing training each year that everybody at the department has to have. That's supposed to kind of line up with your line of work within the department. So whether that be the investigation phase or the reunification phase or adoption. So for me, I supervise the family treatment drug court, and so I have to have specific training surrounding drugs, substance, and alcohol issues. and dependency and those motivational interviewing skills and those sorts of things. As a supervisor, we also have to have supervisor-specific trainings, which, you know, is really talking about how you encourage staff to do a good job and those sorts of things and motivate them as well. So lots of opportunities for training, but you do have to have that minimum of a bachelor's to apply.
To be a real estate agent, there is a 189-hour course that you can take. Some people take it like a college course where you go to the class actually and spend the time in the classroom. There's some online classes as well, and you can go at your own pace. I chose to do online and got it done. It was a little bit crazy, but I'm super motivated, self-starter, get things done. It is a lot of, there's times where I think that I should have probably got a degree in psychology, dealing with different people and their personalities. There's times when I think that I should probably have gotten a little more education in the law area, because a lot of the contracts that we write, there is a lot of attorney jargon in there that you really have to understand. We do have training or hours that we have to complete every year. We have 24 hours, continuing education hours that we have to complete every year. And so we're always learning and growing. The test, you have to take a state test and national test in order to even get your license. And again, it's a lot of contracts, lawyer, attorney jargon, and then also everything changes. There's something that changes every year, so the continuing education is super important for that.
So for physical therapy, depending on what state you want to practice in, there's different guidelines and different restrictions. So I was born and raised in New Jersey, and I went to school in upstate New York. So for me, there was a requirement to shadow a physical therapist, or not necessarily work as a job, but just be an observer for a physical therapist or a physical therapist's office for X number of hours. I forget exactly what it was, but it was a decent amount. It might have been 100 hours or something. So that was in before you can even apply. That was before your application goes in. So they need to know that you are committed and want to do this profession. So that was step number one. And then the way that I did it, which is, I guess, non-conventional, is a 6-year entry-level program, which means that I was accepted to a 6-year program, and I didn't have to apply to grad school, which was huge for me. And that just basically means that if I stay in good standing with the college and I keep my GPA up, then I was in for all 6 years, and I would get a bachelor's and I would get my doctorate of physical therapy. Okay, we kind of skip masters in physical therapy. It used to be only a bachelor's, then it switched to a master's, and now it's only a doctorate. And every physical therapist, as of 2020, has to be practicing under a doctorate degree, unless you've been practicing for a really long time and you're grandfathered in. But for now, for you guys, everyone needs a doctorate. So the way I did it was, like I said, 6 years. You will be required to do summer internships. Clinical rotations is what we call them, and that's where I kind of moved out to Colorado and knew I wanted to stay here. So I did a clinical rotation in Loveland and also up in Longmont, and then my last one was in Parker, Colorado. So I was kind of all around. My parents are in Denver, so that helped as kind of a base camp. But anyway, so that's number one, to get the DPT, the Doctorate of Physical Therapy. For the college that I went to, which was Ithaca College, I was also required to have a minor. I started with psychology, and I went to like the first week of classes and hated it. I hated that. Retrospectively, I wish I would have stayed in the class because I think it really would have helped. But I was a freshman in college, so I also think that the way I didn't like it was because there was always like a gray area, and I was looking for 2 + 2 is always 4, and psychology was like, well, maybe sometimes it's 5, and I couldn't comprehend that. So that's where I kind of switched to like, this is exactly math and science. This is where the muscle is, and there's no deviations from that. So that was something that I struggled with myself. But so I switched to outdoor pursuits, my minor, which was challenging to get my parents to help pay for, because I was basically paying to have fun, and go outdoors. And my rationale to my parents was, I know what I want to do with my career. I want to be a physical therapist, so I might as well have fun with my minor if I'm required to have one. And so that's what I did. I was able to study abroad, and I took 2 college classes like on campus and then studied abroad, and I got my minor. And I was really fortunate to be able to do that. That was like the best semester of my life. I was able to go to Australia and New Zealand, and I was in the backcountry for 4 months, so I loved that. So I'm sure we'll get to more fun experiences later. But the other approach is to get your bachelor's first, so 4 years of undergraduate, and then 3 years of grad school, which means you have to apply to a grad school, which is a very competitive field in physical therapy. So you're basically saving a year of tuition if you do 6 years, but it's a little bit more intensive. It's an accelerated program. So I did 3 years of undergrad and then 3 years of grad school. So technically it was still 3 years of grad school, but my senior year of college was a grad school year. So I wasn't partying as much as my other friends, but it was a sacrifice I was willing to make. I was happy to be working a year ahead of my other friends who didn't do that program. Once you're graduated, you have to take a national and state licensing exam, which is incredibly stressful. I forget how long it is. It just kind of is a black space in my memory right now. It's like 4 or 5 hours of computer test, multiple choice answers, but every answer is correct. You know, it's one of those tests where it's pick the best answer because they're all right. And that was just, you know, you just come out like your brain is just mush. But somehow I passed it. And then you have to apply to a specific state licensure. So I passed the Colorado State Licensure Board, and then I was licensed and I could work. And I found this job here in Canyon City, and I've been, like I said, working here for just over 3.5 years. Like everyone else said, we have continuing education we have to do. I believe our hours are 36 hours, and that can include online or in-person courses, which of course has kind of changed now with COVID and everything. But we do have a good relationship with what's called NIOPT, which I don't remember the acronym, but it's basically a manual therapy certification, which I've taken a lot of classes, and there's a certification, course that you can get more letters after your name, basically. So if you see doctors with like tons of letters or any provider with tons of letters, it's probably because of a extra certification. So that's what I'm training to go for now, and I think it's 13 courses, and I've taken like 4 of them. So it's a long process, but I'm in the works of that. Other things we have to do, there's ongoing continuing education separate from your position. Things that change in the hospital. We have what's called LEARNs, which are, they come out every month, and there's certain things that have changed procedure-wise or new upgrades in technology, different lifts that we have to use. There's tons of stuff that change in our profession, not necessarily with technology, but more of just procedures and new ways to do things. So that's always changing. And then I'll get back to physical therapy assistants, which I talked about before. We have both PTs and PTAs. So for a PTA, you don't have to get a bachelor's degree. It's a 2-year program. And the only difference in what you can do once you're working is that you can't do the initial evaluations and the reassessments like a physical therapist can. So you can still do the treatments. You still learn the same the same stuff essentially in school. It might be a little bit more in-depth with physical therapy or a physical therapist, but the same basic skills. And then going back to school, there is tons of stuff we have to learn. It's going back to the basics of statistics and physics and biology and organic chemistry, but then also we get into more like anatomy and physiology, pathophysiology, pharmacology, tons of stuff that kind of get up to your clinical reasoning skills and stuff that you can't learn anywhere else. We don't really learn takedowns, so if you're looking for that, it's the wrong field. But we do have de-escalation training similar to everyone else. But yeah, we've never really had to do any takedowns. But I guess if we had to, if someone was we have security at the hospital, and technically we should know where their injury is, so just kind of hit them in the knee or something and they'll go down. But not that I'm saying you guys should do that. The other things that we have to be up to date on is, let's see, I think I pretty much got everything. I'm trying to think if there's anything else. Yeah, I think that's it. If I think of something else, I'll come back to me.
Okay, so Tanya, we talked about education and we talked about training. Can you please share with us what other kind of careers or industries that you would be qualified to work in?
So the great thing about social work and a social work degree is it opens tons and tons and tons of doors. So as a social worker, you can go the educational field. So school psychologists oftentimes start in the social work field. School counselors oftentimes start in the social work field. Child welfare obviously is one of them. Probation, I believe, hires social work graduates. And then there's always kind of that next level. So you can get your master's and also a licensure in Colorado, and you can then do many of the things that a psychologist does. You can, obviously the counseling is kind of a field that you hear about oftentimes for social work. That could be drug and alcohol counseling, that could be mental health counseling. And let's see here, it's totally just a helping profession. And so anything that you think of kind of as a helper, probably a social worker could do it. A lot of times social workers could actually then apply to get their teaching license and do some of those other courses and go down the education field specifically. It's a great kind of field to be in just because there's tons of flexibility.
So this is very specific. There's not a whole lot of growth for real estate agent, to be completely honest. The next step would be to be a broker. You have to have obviously more education for that. That would be the next step, and that would be basically managing an office of other realtors. You're basically the boss, and you are also not that you're the boss, but you're responsible for everything that they do, right or wrong, on their contracts. It all falls back on you. So that's really the next step. There's not a whole lot of growth per se in the field. It's very specific.
So similarly, if you get your PTA or PT degree, that's pretty much what you're doing. But if before you got that, you just got a bachelor's in clinical health sciences, which is what mine was, or some other health degree, you can kind of branch out into any health field. I mean, you could do anything you want to do, athletic training, you could be a personal trainer. The list kind of goes on and on. There's tons of stuff you can do with that kind of profession. But once you get the PT or DPT, that's pretty much what you got to do. Advancement from that, you can be a boss, essentially, like a director of rehab, and we have one of those at our hospital. The only downside to a director is potentially a lack of patient care. So I forget the percentage that my boss is working, but it's usually like 40% patient care and then 60% administrative, roughly. And I'm sure that that can vary a little bit. But so you kind of give up a little bit of your patient care, and that's why a lot of people stay just working as a physical therapist or a physical therapist assistant, because that's what they got in the field to do, is to work with the patients, and they feel that regardless of whatever pay increase you may get or more responsibility, you kind of lose that position why you got in there. On top of that, as just a physical therapist, you can go to more schooling. If 6 years wasn't enough, you can go to a fellowship, which is usually 1 to 2 year program, which gets you ready to take a board certified specialty, which again is just more letters after your name. So you can get like an orthopedic certified specialty, which is abbreviated OCS after your name. And we have a lot of people working towards that process now in our clinic. It's usually a certain number of hours. Again, I'm not taking the class right now, so I'm not super familiar, but there are levels that you can progress after. Same thing with the manual therapy course that I'm taking now. It's 13 courses, but after you get that and you pass the test, and you get manual therapy certified initials after my name if I pass that course, if I get through all 13 classes. So there's different certifications and specializations that you can get after the very generic DPT degree, and that's based off of your field, your interests, but there's plenty. There's pediatrics if you want to work with kids. There's geriatrics if you prefer working with older populations. There's neuro, so people, strokes, traumatic brain injuries, spinal cord injuries, stuff like that. You can work specifically and get more in tune with the neurological side of physical therapy. There's plenty of certifications, so there's always progressions and specializations that you can get.
So I didn't mention this the last question too. You do have to have a bachelor's degree to get into probation. We're not structured our tier system is pretty simple. We have support staff, and then we have probation officers, and then we have supervisors. So there's one supervisor to every 6 probation officers, and then there's one chief for every district, 22 districts around the state of Colorado. So just within probation itself, there isn't a lot of upward movement. Most people that get into it just want to kind of be a probation officer. And they, I've known a lot of people that have just been a probation officer for 25 to 30 years, and then they'll just retire. The good news in being a probation officer is if you take all those skills and things that we've talked about, they're pretty useful outside of the judicial world. And so you could, easily retire and go into, go back to work for maybe a DHS scenario. You could take coursework to work for like a treatment provider, because you understand the dynamics of client and behavior change. So I think there's a lot of things that you could do. You could probably get back into working at a school, whether it's like in a security-based job or substitute teaching. Those would be pretty general, skills that you could use all over the place. So I do want to talk a little bit about within probation, though. I don't want to make it sound as mundane as just you're in there just seeing clients. So we have, a lot of disciplines within probation, and so you might have a generalist caseload where you just take on, criminal mischief cases, harassments, assaults, those types of things. But we have a lot of other jobs that require more specialties. And so if you're a domestic violence officer and that's all you supervise is domestic violence cases, there's kind of a nuance to that because of the expectations for those cases is a little bit higher. The same thing for sex offender officers. So if we have somebody that's supervising a caseload of sex offenders, they have to know what the state standards are. So you have to be more familiar with those kinds of things within those groupings. And we have juvenile probation officers that only handle juvenile cases. So anybody under the age of 18 would be supervised by a different officer than somebody that supervises adult clients. And so so there is, there's different things that you do, and typically at my shop at least, what we do is about every 3 to 4 years, if you've had one group, then we rotate you out and you start in a different group, just because you can get kind of complacent and it doesn't become as much of a challenge. So we try to rotate officers into other caseloads just to keep things fresh, and they learn new skills, and then they see new clients. So.
Okay, so as we move on to thinking about the future, can you please talk about how technology has changed your position, your job, and also what kind of changes you see in the future? So, Tanya, do you want to start?
Especially with COVID, we have had to really get creative with how to continue to show houses. We have virtual showings where FaceTime, Messenger, Zoom meetings, I'm sure you guys, the Google Hangouts, we have had to step up our technical game in order to continue to do our job. I think that people buying houses online without seeing them, that's kind of the wave of the future. People are doing it all the time. It's like the dating apps and the dating websites that started a long time ago, and how crazy we thought that was, that people are meeting and getting married without, they meet online. Well, it's kind of the same with the house now too. That's really happening. I think that it's going to continue to progress, again, with technology and being able to show a person a house that lives on the East Coast, and we're in Colorado, and they
they can see the house because we're there and we can video and all of those things. So technology, I think, even in the 5 years that I've been doing this, has been, it's changed dramatically. And you have to be ready and willing to, do that. Some of the older agents that have been doing it a long time have a hard time with that technology piece of it. So if you're technical and creative and have a new way of doing things, you're kind of on the cutting edge, which is exciting.
The biggest change with physical therapy, and not just recently, this has been a progressive change, is going from paper charting to all electronic. For being in school now, or recently at least, that was all I knew, so I didn't know paper charting. But previous generations did use paper charting for all their documentation, which I can't even imagine how crazy that must have been. So it's really nice to all use electronic, but that's what you guys are familiar with. Everything's on the computer, everything's online. As far as actual physical therapy interventions, no real changes. And that's what we pride ourselves on, is that we're hands-on, we're working with you, nothing is really changing, which is a little bit scary to think about that there would be any changes in that. There are progressions in like telehealth where there's these really cool braces, not here in Canyon, but that doctors can put on their total knee replacements, and they just bend their knee, they're doing their exercises, and the doctor can see how far that patient bent their knee, and they just see it on their computer screen, so they don't even have to follow up unless they don't get a certain range of motion or something like that. So cool stuff like that is up and coming. But the biggest change for us is just all electronic charting now. All of our communication is through direct, secure chats with providers, doctors, physicians, physician's assistants, whoever it may be who's referring them for physical therapy or other services. I guess other technology changes would be different types of lifts. So sometimes if we have, we're always worried about our bodies because we're kind of in a physical manual, I'm not gonna say manual labor, but we have to use our bodies to do our job. And so if we injure ourselves, we're in trouble. So we have to be aware of our body positioning at all times when we're working on somebody. And so if there's a larger patient that we need assistance with, we're not gonna do it ourselves, or even with two people sometimes. So we use these mechanical lifts, and they have like a sling that'll go underneath their legs and behind their back, and it's a hydraulic lift that lifts them up if we need to transfer them from the bed to the bathroom or to support them while they're walking. There's different types of devices like that that have changed technology-wise, and that's where that continuing education comes through, so you're up to date on those changes and how to use them effectively and when to use them. In general, in the future, healthcare is kind of at a tricky spot right now. Costs are going up, reimbursement's going down, and that's not a good sign for healthcare, but that doesn't necessarily mean that there are less jobs or less opportunities for positions in the healthcare field. It just means that we have to work a little bit harder to be more efficient, and that's always being worked towards by our leaders and helping us with that problem. So I think overall, no real changes in how we do our job. It's just the tools that we have to make our job easier.
So I think probation is kind of exciting in terms of technology and advancements that we've seen in the last couple of years. Of course, we still have like computers and some of the littler things that we appreciate are systems like treatment providers can now sync with our documentation system. So instead of us having to enter like treatment notes like we used to, it goes in automatically. So that's one of the less exciting things that I'll tell you about. Some of the more exciting things for us is, again, if we had a high-risk client that we were afraid was going to do something in the community where it was unsafe, let's just say 5 years ago, we would be out, let's just say 3 times a week at night, maybe because we would have a curfew imposed on those type of clients. So, of course, many years ago, they came out with ankle bracelets, and if you've ever watched, a movie, you get a general idea of how it works. There's a rubber band strap that goes around. It's pretty hard plastic, so that they can't take it off. I mean, that would defeat the purpose. But so that monitor actually just relays a signal to a box that goes in their phone line, and so it'll tell us that they are within their home. So home detention, monitoring, those types of things is pretty easy now using that technology. If you ratchet that up a notch, we have global positioning satellites. So same idea, you put a ankle bracelet on there that's a little different, it's a little bigger. I wish I should have brought them to show the difference. But it's a little bigger unit, and so that's one that we can actively or passively know where a client is. So generally speaking, those go on our high-risk sex offenders, and so we can track their movement through the community. So if they are, usually they can't be within 100 feet of a school. And so we can look at their path. If it's the next day in a passive system, we can track where they went that entire day, and we could be able to see if they walked by a school. And then we can reprimand them for that, or they have to go back in front of the judge. There's active tracking too, so we can pull it up right there live time and see they are at home, or they're near, or they're at the grocery store, or they're supposed to be at the grocery store. Those types of tracking abilities, we have that. And so I talked a little bit about substance testing. So the widely used one is still urine testing because it's cost effective because it's just cheaper. But we also now have saliva testing. We have hair follicle testing. I can see a time when we have, chips underneath their skin, and it'll give us a continuous monitoring. I think that's probably, in the next 5 to 10 years. We already have another ankle bracelet that's just a transdermal receiver, and that monitors their alcohol consumption. So instead of having them do breath tests and urine tests all the time, we have a constant readout of what their alcohol, because if you drink alcohol, it processes through your body and it comes out through your skin. So that monitor tracks alcohol out of the skin. So just trying to think if there's anything else. There are some units in cars. So if you're a multi-DUI offender, you've been drinking and you've been driving, there's the ability now to have an intoxilizer system in your vehicle. So when you go in your vehicle, you have to, there's a box that goes on the ignition, and so you breathe into the tube, and if you've been drinking at all, your car is not, it's disabled. And so you basically go in, you blow in the tube. As long as you're not consuming any alcohol, your car will start and function. You can drive to work, you can drive to other, appointments, and nothing happens. So that's probably about it. But I think, again, we see a lot of things coming down the road. There's a lot of cell phone apps too. I don't want to forget that. So a lot of check-in stuff that we can do. Offender Link is a system that'll help you supervise. You go and you answer basic questions, you submit it, and then it goes into your probation officer's computer system. So, but there's a lot of other apps that are in the build right now that help us track and monitor clients. So a lot of exciting technology.
We suck at technology, just to be honest. We've had the same computer system since 1999, and they're finally updating it for the state. You guys would hate being in meetings with caseworkers because we don't know how to work Zoom, and so COVID was a complete disaster. So that's probably part of the reason we were still out seeing families face to face, is because we don't know how to do anything else. So it's been a learning curve. I think in the future, again, thanks to COVID, we've had to learn some new things, and so I can definitely see that it's gonna be part of our training. It's gonna be something that we learn to do differently. So it's gonna be a long road ahead, but I think hopefully technology will help us in the future doing those virtual visits, virtual meetings, those sorts of things.
Okay, so we have about 5 minutes left of class, I believe. So can we open it up to questions? Are there any questions?
I have a question for you.
Okay.
So if you got like house arrest for like a week or something, and you have to like take a shower or whatever, are like the bracelets and stuff waterproof?
Good question. They are. So they're really sealed in a pretty compact. It's a composite case, and so. But generally, what I think the technicians ask them to do is, if you get a piece of plastic wrap or whatever, you can put it around your entire ankle, and then just, because I don't think they suggest like you can't swim with it. I think if it's submerged, it's not as airtight as you would think, but for just like general water running, they're pretty safe.
Okay, any other questions? All right, so we have just a few minutes, I think, literally a few minutes. Can you just, real quick, the best thing about your job? Ethan, start with you, since you're shaking your head.
Best thing, other than what I talked about before, getting someone better, I think it's just kind of seeing the joy and like the determination, the hard work that they took to get to where they were at before when they were really impaired, really functionally unable to do whatever they wanted to do, their daily activities, to getting them 6 months or whatever it is later, and you see them out in the community and they're riding their bike or they're playing tennis or whatever they wanted to do, they're back doing their regular activities is rewarding beyond words.
Yeah, the same, just clients that change and, the community is safer as a result of them making the choice to change and that you helped them.
Pretty much the same, positive change, happy, healthy families.
Helping people and building relationships with people.
All right, thank you, panel. I guess we are done. Are we going to release them from here, Ms. Shaw? Or okay. Okay. All right. So you guys have just a few minutes to sit tight. If you have any other questions, please feel free to ask the panel.